bills around and get the signatures. Okay.
We're passing the bills around as we chat.
Okay, good.
I will make a motion to accept the meeting minutes from December 27th, 2023 as presented.
Second.
Anybody have anything to add or? All in favor?
Aye.
Okay, that's.
I'm just gonna ask everybody tonight for the meeting to speak slowly and clearly, because Lori will have to get the minutes off the recording.
Okay, well, you really just want to make some notes of who made the motions and seconded them.
Yep.
The vote was unanimous by the attending members, and the motion was Heidi's, and the second was Bill Caval's. Okay,
Yep.
Joyce, if you would like to jump into the health agent's report. And
Sure.
The discussion items will take up separately from the report at the end, okay?
Okay, so as far as the health agent report, unfortunately,
Hey, sorry. The MBTA group, you know what it is?
No,
No.
this is the Board of Health.
There's one downstairs going on as you come in. Oh, hey, Bill. Good, how are you?
this is when we face that. So unfortunately, because of the issue with the server today, I'm not able to access my report in writing. So I can give you a brief update that we still have a number of septic systems in progress. I've been out doing inspections, that's fine. Kathy, our grant inspector, is back as of today. She was on vacation for the holidays, so she's resumed food inspections. I've done some re-inspections last week to supplement while she was away. We also have a possible illness at one of our care facilities that is in hold right now. We haven't received confirmation yet, so I am in contact with them.
What are they talking about?
E. coli.
Oh,
But as soon as I know anything, I'll let
food
you
E.
know.
coli?
Well, there's a question of if it even came from the site. This person, the resident, is on and off property. So it may have nothing to do with the property itself. So I'm just waiting for confirmation.
Okay.
I will be meeting with the facility tomorrow, either by phone or in person. I'll probably go down to do an inspection at some point just to say that I have seen the kitchens and gone through everything. They have all their logs. They actually reached out to me on Friday afternoon, and I spent about half an hour, 45 minutes on the phone with the director, food service director, just going through everything. And they're very squared away. They were able to, talk to me about all the temp logs. She's reached out to purveyors. There's been no active recalls. They've done everything that they can. So there's just a waiting confirmation, a hospital confirmation that this is in fact what the person has. So again, as that progresses, I will let you know. Nothing has moved forward on any of the pending cases. That's just on hold. And then an update on a new establishment, Paisanos. I'm sure you're all aware that it's been under reconstruction. That is actually due to open late January, early February. I have done multiple walkthroughs with the owner just to make sure that everything is where it needs to be. I have to say they've done a remarkable job of really bringing everything up to where it needs to be. And I think that everybody will be pleasantly surprised when they go in there. Yeah, so hopefully, excuse me, the end of January, beginning of February, it's when they're aiming to open at this point.
And Keegan's is looking at mid-February.
Yeah, I haven't heard anything from Keegan's
I
yet.
think they go home back to Korea
Yeah, for a little bit.
for a little bit with the Chinese New Year.
Yeah, so
So-
hopefully, I'm hoping they'll open sooner rather than later.
You and I both, although my
But
waistline is not.
yes, so as soon as I have any confirmation on that, I'll be sure to let you know. I will be teaching the Serve Safe next week on Monday all day. I believe we're up to, I think, 13 people.
Yeah, I shared it on my Facebook and I
Yeah.
reached out to a couple other people I know. And I was like, hey, this is
Yeah.
really affordable.
Yeah, so we've had good response for the first time, so I'm happy about that.
I don't know if I'm talking out of turn here. I meant to follow this up when you first told me about it. Have you spoken at all to Sue Giovanetti to see if anybody associated with the shelters might be interested in going through it?
Well, I have talked to Sue and we did put it, we've let all of our permitted people know. We sent out emails saying, hey, we're doing this.
Oh, okay.
And because they're a food pantry, they're not actually required to do Serve Safe. There is a special thing through the state that they can do to make sure people are handling stuff correctly, because they're not actually cooking the food.
Okay, actually, I wasn't thinking of them. I was thinking of any residents.
Yeah, the issue becomes.
Maybe the homeless.
Yeah.
The shelter residents.
Yeah, she's aware that the class is in session, but
Okay.
I haven't heard anything back from that.
Okay.
But that, speaking of Sue, two things related to Sue. One, I met with, a person whose name is now escaping me, Karen. She's from BID, and she's basically like the liaison for BID, that whenever they do capital projects, a certain percentage of any improvements or money being used has to come back to the community. And so she reached out to me to find out what kinds of needs we had. We had a great discussion, met for about an hour here. We will be touching base in February because, as I had said before, I'm really hoping to have a blood bank and a health fair in late winter, early spring. And she is more than happy to help us with that and supplement it would be great to have some resources. So we're gonna meet towards the end of February to kind of get our ducks in a row and see what we can come up with to make this happen.
I
So,
can help you at the beginning of March.
okay, yeah. So hopefully, and she was really great about, they're looking at ways that they can help us, like what the needs are around seniors or different populations that may require different things. We also discussed the English as a second language issue. Apparently they're looking to do some stuff with helping to teach people English. So when I know more about that, I will let you know, but that is in the works. I continue to work with the public health interns to come up with flyers in different languages that may be helpful to different businesses. So as that, they're doing edits right now. So when I get that information, I'll bring it to the next meeting when I have it. So that's pretty much, I went to the Region 5. I've been to 2 meetings there. One was on Zoom and that was canceled because it apparently got hacked. So I did not miss anything. Well, apparently I missed a lot. And then the second one was in person, and that was more of a lot of stakeholders. So they had people from various hospitals and care facilities, and really talking about like, what do we do in an emergency and that kind of thing. So it was useful for me to at least see who the team players were, and that was held in Middleborough. And I think that's pretty much it for the health agent report. The other things will come to the agenda.
Okay, Joyce,
Yeah.
okay, you want to just talk a little about where are we at on the public health nurse position?
Okay, so I'm guessing everybody should know at this point that Michael resigned
Yeah.
upon his return from vacation, so he's no longer with us. At this time, we're just using Pat as the grant nurse. I'm kind of holding off on putting anything out at the moment till I find out what's going on with the grant and the nurse in general. So when I know more about that, I can make a better plan to hire somebody new.
Yeah.
So that's.
Continue to develop.
Yeah, so in working with Pat, and she's, back, she's doing all the clinic, she's doing the educational
The
pieces.
Maven all up to date.
Yep, she's covering Maven, so we're good. But going forward, we're gonna see where this is gonna go. I'm not sure as far as, they may be getting a second person through the grant, so we'll see what that's gonna entail. More like this,
So even if they got a second person, we still,
we need a nurse, yes. There's some potentials coming down the pike.
okay,
And so I'm just trying to hold off until I know for sure, because I would hate to lose out on an opportunity.
to hire the right person. for the
Yes,
job.
I want to make sure that this is a good fit and that we don't go through 4 months of somebody thinking this is going to be a good position, and then it turns out it's really not what they thought it was going to be.
Mhm.
So I want to make sure that we do it right.
Okay.
So that's why I'd like to hold off. We are supposed to be getting a social worker and an epidemiologist through the grant. I think the social worker would be invaluable.
I agree.
The bid, the job descriptions are up and they're posted. I know that we got one application for an epidemiologist. The grant meeting will be on the 30th of January. I'm hoping to attend it. Unfortunately, I was selected for jury duty on that date, so,
Are these full-time positions or part-time?
I believe that they opened it up to 2 part-time. They have enough for full-time, but they put it out as part-times to see if they could get more people to apply to it. So I don't know what the end result is gonna be, but anything will be better than no social worker. So I'm hoping that somebody's gonna pick that up quickly. So, and like I said, I'll know more on the 29th, or excuse me, the 30th, so. Hopefully we'll have
You
more.
want to make sure, you really want to make sure that Tina's aware that we fully intend to replace the position of public health nurse.
Oh, she knows. I've
Okay.
already been very clear about that.
Yeah, I just don't want to see that funding go somewhere else.
Nope.
Okay, as long as we're on the same page.
Oh, no, we will
and
have
then-
nurse.
Okay. The only other thing, we wanted to speak about, an application pertaining to the loan program, I believe. That wouldn't be under discussion. Discussion is when you're gonna let us know about the change in the fee schedule on the loan, but.
Okay, so
Go ahead.
the only other issue I have, it's come to my attention through Old Colony Planning Commission. We have a couple of applications, due to some issues, one application's on hold. I have another one that initially, when I looked at the plans, I did not review these were reviewed a couple of years ago. And I guess for whatever reason is coming to fruition now through this betterment loan. And when I reviewed the application, the betterment loan is supposed to be to replace and repair an existing system. So if you have a 3-bedroom house,
With an equivalent system.
it's only supposed to be for that 3-bedroom house. It's not supposed to go to a 4-bedroom house. Unfortunately, this application has upgraded their system to include a 4th bedroom. And so the issue becomes, I'm looking for the support of the board to take a vote to support in recommending that the application be denied as it appears now, as it is presented, because it does not meet the standard of what this betterment loan is for. So this person could conceivably go back to a 3-bedroom, and then they would absolutely, no problem, meet the requirement for the betterment loan. But because they're trying to upgrade it, it doesn't really fall within the parameters of what the betterment loan is supposed to be for. So, at this point, I'm just, seeking a vote that support the recommendation that the application in its current form be denied. And at least that gives the applicant an opportunity to adjust if they see fit.
Does the betterment loan outline that is just to replace existing with existing?
Yes, it says repair, replace, or upgrade, meaning that repair or replace means like repair a D-box,
Yeah.
replace a line, or upgrade, meaning the whole system has to come
It's
out.
not upgrade.
Not upgrade, like add more bedrooms.
Okay,
Yeah, I've been on multiple phone calls with Old Colony. 'Cause
I was just curious. 'Cause
No,
that's
no.
how I could see upgrade as,
Right, no, I did too, and I wanted to clear, that's why I asked for clarification.
okay.
So I was told through the Old Colony that it is to just replace what is there.
No, don't we usually get to see what who it is and where it is and all that? The application,
Well, yes, I mean, but
who is it?
I'm not gonna say.
You can just say the address. We're allowed.
I don't
what's-
know
We
that I
usually
don't
see
know off
that
the top
stuff,
of my
don't we,
head.
Joe?
Want to say that again, Bill?
Don't we usually see that stuff?
Only if there's a variance involved in the construction of the design of the system itself. What Joyce has right now is an application for finance to increase the size, basically to increase the size of the system beyond that, which would be necessary even for a 4-bedroom. The leaching proposed in this particular application, as described to me, we pretty much say, if you're gonna build a septic system in Kingston, you gotta have 800 square feet of leaching area. This particular application goes beyond even that. And this is what she's.
If I remember it, it's like
coming to the board.
871 or 875, and it
Okay,
shouldn't
so it's
really
not like
exceed.
1,200.
No,
Okay.
but it's still outside my concern is it's outside the parameters of the loan. I don't want to get in trouble for paying something that doesn't fall within the parameters of what the loan is supposed to be for.
Now, Joe, are they still doing 3-bedroom septics? Because I know at one point they had gone to
No,
even numbers.
No, and like I say, this is an 800, we require that when a septic system is replaced, we require 800 square feet of leaching, or they can apply for a variance. And usually what we'll do in a case like that is put a deed restriction on the house. So
Yep,
in other words,
you
if
know
somebody-
I'm famous for doing that.
I'm sorry?
You know I'm famous for putting deed restrictions on when it comes to those variances.
Yeah. Well, if
So what
somebody
I'm
wants to
saying
build
is, you can do a
small system-
3-bedroom septic, it doesn't have to be a 4-bedroom, because at one time they were making it so you had to do a 4-bedroom, they weren't accepting, they were doing 2 and 4s, they weren't accepting 3s under Title V for a period of time.
Right, but the thing with us is our local ordinance says that when they design the system, give it, there's sufficient room, obviously. We want 800 square feet of leaching on that system.
He's not listening to what I'm saying.
That's what we're looking for. But in this particular, go ahead, in this
Joe.
particular, case, yeah.
Can you do a 3-bedroom septic is all I'm asking.
Yes, you can,
Okay,
that I could
the
tell you.
answer is
That's
yes.
it. That's all I want to know.
They can do a 3-bedroom system.
Okay.
But if we
I
were
see.
going to approve a plan with a 3-bedroom design on it, we would put a deed restriction on that plan when we gave them the
So-
variance.
Yeah, in this situation, would we be better off to, I think I would lean towards what Joyce is saying and telling them that as presented, this does not meet the betterment loan requirements. And just let them know that the expectation is to do the appropriate septic to replace existing
For
with
3 bedrooms.
for 3
That's what
bedrooms.
That's what Joyce wants to do.
That's what I'm
She's
saying, I'm
looking for the
supporting.
Support of the board in doing it. That's what she's asking, I believe.
Okay,
Joyce, you
I
can-
motion that we grant our health agent, Joyce, permission to, Joe, help me with some words here. Permission to
Deny the application in its current form.
deny the application as currently presented.
Perfect. That's what Joyce is looking for.
Okay,
Well, I'll second it,
Okay.
but again, Joe. I thought we always got these in front of us, so we know.
that's
It's
what the
only
var-
if it's
this
a
isn't
variance.
We don't have to, it's up to her.
No, it's not a variance.
It's not a variance.
Yeah.
What she's saying is,
I heard what this, yeah.
Yeah.
Yeah,
because what the person's doing is trying to look for this betterment loan to improve their septic, to make it a 4-bedroom.
Yeah,
So
right,
then when they go to sell their house, they go out a 4-bedroom, not a 3-bedroom.
right,
You know, and that's not, the betterment loans, they're more to.
And we're
No,
running
I
out of,
agree
the other
with you
issue is we're running
100%,
out of money.
But I always hate anything that has to do with he, they, or who. Who is it? That bothers me. Is it God?
Well, there's a
But
reason
how about-
for that here.
Why
and
don't
the-
we look at it across the board? How would you feel if my 4-bedroom septic, if I said I wanted to replace it and I want a 6, and can I use that betterment loan? I've got plenty of land to put on a
No, I
couple
know
more
you do.
bedrooms.
Well, and the
But
But
issue
why
also-
should you have to
I
pay
might
for
come and
mine?
live in your garage.
But the issue becomes like, I'm coming down to the end of this loan.
No, I
We
agree with
don't
you
have a lot
100%.
of a lot money left, maybe 3 systems, if that.
Is there any money, how much money is involved? Do we know any of that?
And that wouldn't come through me in the sense of I don't get the estimates and they're responsible for
But she's
getting.
got enough to do like 3 or 4 more
No,
It's
systems.
like
agree with you
$112 in
Well,
$112,000. And so if somebody's oversizing it than what they need, it's kind of not fair to the next guy who's just looking to put in the system that they already have.
I agree with you 100%.
Yeah.
But like I said, I was in charge of hundreds of people and I hate he, they. or who.
No, and I
I
get
like
that.
names.
I am also doing this so that it's fair across the board. I don't want anybody to think someone's getting special treatment because the board knows who it is
You
or
don't
doesn't
even
know who it is.
anybody, really.
Well, it's just better that way. From my perspective, that way it's just clear across the board. Everybody's on a level, fair playing field. All right, so Bill seconded the motion.
No,
Do you guys need to do anything else? You can vote.
Yeah, all in favor.
I,
Aye.
Motion passes. Okay, moving on.
Um,
Janet, yes.
yes, well, Joyce is still, on the hot seat. I wanted to pick up on a few things that you had mentioned.
Sure.
So, I'm not talking out of turn, out of a meeting, outside of a meeting. The public health nurse, yes, I think it would be important to get on that. I am volunteering, if you would like my help,
Oh,
to
absolutely.
be on the interview. committee.
Absolutely. You and Heidi, absolutely. Would not turn that down for a moment.
Okay, secondly, adding fuel to the fire, I think the hourly rate needs to be re-examined. I think it needs to be higher to get the type of person we want.
Okay, well,
Off the
examine
rec-
away.
Off the record, I will tell you what I make. I'm not announcing it on a public forum.
Yeah,
Just so you have an idea of what nurses.
yes,
Oh, yeah,
I'm very well aware.
Okay.
Yeah.
Yeah.
I do realize this and it was, the issue was just going in front of the finance committee to get it passed to where it was like an act of God.
Mhm.
So I
realize
don't
that.
know how you guys are, how we can convince them that that needs to be raised.
Well, I can print out at least a dozen jobs that I get offered every day, making $50+ an hour.
Yeah,
Yeah,
know,
I
that's,
think that issue becomes though that we're asking them to do Maven and at 15 hours a week, it's really focusing on the Maven and the services at the COA and some educational stuff. And so obviously we don't necessarily need somebody with your credentials in that position. Meaning a
Well,
doctorate.
not necessarily my credentials. This is.
I say in the
Just-
background of a nurse, you gotta have 4 or 5 years of college for the,
Oh, yeah, I mean,
so
Absolutely.
$50 an
I don't
hour
disagree with
nowadays
the
is nothing.
rates low. I just don't know how we can get it up.
Joe, how would we go about getting it raised? Do we have to take that to town meeting or can we just go to finance with it?
Well, the first step would be, why don't we just table this for now? Wait until Laurie comes back and have Joyce have Laurie contact other communities that have a public health nurse and get a feel for what they are currently paying that position along
Okay.
with the grant. Then we'll have a base to work from. That's what
We'll
I
get
Okay.
the grant nurses too, so we can
Yeah, I
use
know
that
what the
for an
grant
idea.
nurse makes.
We know.
Yeah, I
that.
think it's more looking at the grant nurse. We've done this before. We're playing the tape back. We have done this
No,
before.
we haven't
Know
done
that a
that.
number of the communities
Oh, we've
don't
done
pay
this.
well.
Yeah,
We,
We've done this.
absolutely, we have done this.
the grant's
And,
at 39.
We have done this, but we also have a history of we have a history with the nurses who've been in the position as well. So I think all of this needs to be considered. And,
Well, why don't we see what we can do, find out, and I'll ask around for different towns and go from there.
The other town's argument has always been a strong one at town meeting. That's the only reason I bring it up.
Yep.
So, moving on. Janet?
Joe, one question, it probably
Sure.
would go with the guy that runs this building, manager, whatever he is,
Mr.
says he
Hickey?
wants to take $1,000 from us.
What?
It doesn't say, but it was on TV and I watch all this, Jim, especially with him. I already yelled at him. Where do we have $1,000 laying around, Joe?
And he
Oh.
already took all our COVID funds that we did
yeah,
all the
that
work
we
for.
did the work
Absolutely
for,
not.
and they went to the general kitty of the town.
I think the
which I'm
$1,000 you're
very
talking
upset
about is the cuts that were made across
Well, I
the
told
board.
him he can't have
Everybody got
anything
banged.
and we don't have anything to give away. I already told him that a week ago.
So you're saying that you heard mentioned in a selectmen's meeting that the
Yeah.
selectmen were going to appropriate $1,000?
Well, no, he did. He said that was one of his, on his list, that he had a big list of money he was taking away from everybody, and it was 1,000 taken away from us.
Joyce,
I was in the managers meeting, everybody got hit. The
Okay.
finance committees asked they gotta lose money to make up for the 3%, and so that's what they were told.
I'm sorry, the 3%,
The
I'm not,
town administration has been anything but fair with the
3%?
funds allocated to the Board of Health. They took the percentage of the monies that they were getting from the grant, which they've now disavowed, and instead of using the small percentage that was supposed to be used for public health initiatives, they did not do that. They merely put it into the general fund. They also used a lot of our COVID funds for various improvements that came from the general fund. So, we haven't fared well in the budget process in the
No.
past few
Well, just
years.
so
It's
everybody's
borderline
aware.
so what
misappropriation.
do we do? Roll over and play dead here?
Well,
I mean,
I'm
what can
working
we-
on getting
how
a
can we
revolving
proactive?
fund. It's
Okay.
going to go to town meeting in the spring. Because I said if I am collecting late fees and busting my butt, that money should stay in my department. So
Absolutely,
gonna-
absolutely.
Thank you, Joyce.
gonna
Yes.
try and get in a revolving fund as of the town meeting in the spring. So
So we'll
hopefully
look
that
at
will help.
that. I'll drive you back.
In addition, if we come up with other programs that generate monies, up to and including the potential for English as a second language through the Kingston Business Association, again, that money should be isolated to that from which it came, which would be the Board of Health.
Yeah,
And-
that's my thought with the ServSafe. If
Yeah, so serve safe
we're
training.
providing a service, we should get to keep the profit.
Yes.
Not that it's a
yes,
lot,
yes,
but-
yes.
Basically
Yeah,
covering the
but
cost of
it-
my books.
It might
We're not
help,
looking for profit.
it might help offset that $1,000 they're taking.
Yeah, that's my point. That's why I've asked for a revolving fund.
Well, it also might be able to be used to properly fund a public health nurse position.
Oh,
Right.
Yeah, I mean, one of the things I admired about you when we hired you was that you're not necessarily have to stick with the status quo. And just because everybody else is doing it doesn't necessarily mean we have to do it.
Don't say
So
that.
my case in point at the moment is that the nurse needs to be paid more. You get what you pay for. I mean, people who are getting lousy pay
Make
do
less.
not have, they might be good, well-intentioned people, but they're not gonna put the energy, the
There's no
time and
incentive.
energy, there's no
Right, no,
incentive.
and I get that,
Yeah,
believe me.
and I
Oh,
still
I'm
haven't,
aware.
I still have to wonder about, does a nurse have to do Maven? Can a nurse look at the results of Maven and then make suggestions as to what needs to be done? Or can a clerical person be trained?
The problem
to
is,
do the Maven?
so there's two of us in the department. I have been trying to complete the Maven training for weeks. And it just, I mean, it requires time in addition to doing the soil evaluator, the the Title V, RS exam, like, it's a lot, and
I'm
I'm
not
trying to
I'm not talking about
prioritize.
you or Lori. You're more than busy. I'm talking about hiring someone at a much lower rate than the nurse who would be entering that data and then giving it to the nurse, who, if there was anything that was questionable that needed to be investigated, then they can do it.
Yeah, but really, the
follow.
data is from the nurse calling and speaking to the patient.
It's a nurse interview.
Yeah,
Uh-huh.
it's, yeah. I mean, if I'm trained in it, I can do it, but I don't know that I would
Okay,
pass it off on somebody,
okay.
I think we can
Less
table
trained.
this until
we're going forward, yeah,
we
we'll figure it
investigate
out.
it further.
Okay,
All right, just another thing I wanted to mention, so again, I'm not talking out of meeting here. The health fair, I've run health fairs. You know, if you want any suggestions.
oh, I'll be
I'm a
calling you.
major proponent of proactive health fairs where you just don't walk around, get a brochure from everybody and walk out the door.
Yeah.
That it's very interactive, that people get their blood pressure taken,
Yeah.
their pulse ox, whatever it is. They bring their medicines, they can be reviewed with them. You know, everybody, that person goes to every vendor.
Station, yep,
And then sees a nurse at the end who goes over their card with all of their biometric stuff on it. And then their card can be put in a raffle for something. But that's an incentive, so it's proactive. It's just not aren't we a big deal? We're having a health fair and have a bunch of tables.
okay,
Also, I want to get a little further clarification on this BID person, because that could be used. You know, the people, yeah, the ESL classes, absolutely. There are volunteers that are doing it
She's in
now
the
at the
philanthropy
shelter
office, isn't
who
she?
could be doing it. But
yeah. I'm
also,
trying to think.
they want, you know, I've been asked to do free first aid classes down there.
To do free aid,
Yeah, to do health classes for the people that are there.
yeah,
If BID can be bringing in people, you know, to give health classes there, I think that would be far more advantageous and something that could be set on a regular schedule.
well, like you said, I met with her,
Never mind,
Last
they could do first aid. We've talked about this before, when Arthur was here, having everybody in the building trained in CPR and first aid.
well, they did just do a
You know, the
CPR
coaches, the
with somebody from the fire department.
Oh, they did here?
Yeah, yeah.
Okay.
So you know, I'd like to at least give this woman a chance to like see what we can get
Yeah,
from
for
them,
her.
and,
Yeah,
you know, but I certainly will call you to have a meeting to discuss what we should be doing in the fair. I'd like to have a blood drive as well.
no,
I got, somebody gave me contacts for Dana Fava. They have a mobile unit that they'll come down as self-contained and they do everything.
And we also have right in next to Stop and Shop, there's an American Red Cross blood donation center there. We could see if they could
Something
help
to-
us do a mobile when we're doing the health fair.
Okay. Yep. So
Absolutely.
is that progresses? I just need to get through next
Pints
week.
for Half Pints does it too, that's children's.
Yeah,
But when you donate, even though they do Pints for Half Pints, the blood does go to the American Red Cross, as all blood does, and
Mhm.
gets
Yeah.
distributed as needed. But sometimes that's a better draw,
yeah,
Pints for Half Pints, because people always want to help the kids.
right.
Mhm.
So maybe it's towards the beginning of February, we could have a meeting and just brainstorm as to who we want to include in this, if you guys are up. for it.
yeah, because my mind is running wild here over things that we've had issues with in the past. Like we've been talking about, or I've been talking about a town doctor for 6 years. Maybe BID could be the town doctor, so that if we need something, like an EpiPen, if we're
We
running a
can get
clinic or something, we can get it from BID. It's somebody who's assigned to us.
I can talk to this lady Karen about it.
You know, they're running vaccination clinics for the, you know, for us, for the town.
All right, well, I
The
think that's,
social worker, if we hire a social worker, that the social worker has immediate contact with mental health people at BID that can help get the help get the situation going. I mean,
Okay.
I've been in a situation recently. I know of a situation where a person has had a tremendously difficult time getting mental health resources for their family member.
Can't find a bed, can't find a.
You can't
someone-
find it anything.
Yeah.
So, you know, that the social worker could be connected like,
Yep.
with BIDs. It's like, make a phone call. Got this person here. They need to get in.
What can you do?
What
Yep.
can you do?
All right, I can talk to her about that.
Yeah, the ER is full of people waiting for beds, waiting for.
Oh,
Yep.
yeah. Oh, yeah. So BID could be a big help to us. and
Okay.
It's something I've personally wanted. I'm sure you have too for a long time.
Okay.
Okay. Moving on. Healthy Kingston report. Janet.
It's being taped again next week, February 1st. Barbara Ward, who is a social worker, is going to be talking about co-parenting and step-parenting. And the Kingston Garden Club just did an article in the Kingston magazine about having a healthy environment during the winter months with plants. So the woman who wrote that article, Dorothy McFarland, I'm hoping that she will speak, or the director of the garden club
Oh,
will
that's
speak.
cool.
Okay, anybody have any questions for Janet? Moving on. Now, we've got a few discussion items. Some have recommendations, some don't, but it's for information purposes. The first one is the food truck fees. Joyce, you want to talk to the board about that?
So I've been looking as we're renewing permits and dealing with customers. I've been looking at fees, and the 175 to me seems a little high, and here's why. Every food truck needs to get licensed currently in the state, every town that they go to, whether it's a one-day event or they're here 6 times. And for a lot of these smaller trucks that are just local, that's a big chunk. And I know that, my last job, we were doing $100, and that's a hell of a lot closer to Boston. I think that would be a more reasonable price point.
Do you know how much Plymouth and Duxbury are charging?
I do not.
But how often do we use food trucks?
Oh,
lot.
we get a lot of
In
food.
Kingston?
Yeah,
Think about Pottle Street when they do the food trucks down there.
Oh, I don't know. I don't know
Oh,
anything
yeah, all
about it.
summer there's food
Yeah.
trucks.
Oh, all right.
And so the
Okay.
problem, and here's why. So for a one-day event, you get charged $75. And there's no real inspection involved in that because most of the time it's contained. But if you are a food truck, you have to come here. I have to inspect you. You get inspected by the fire department. So now let's conceivably call it an hour of inspectional time. By the time I'm done with you, fire department's done with you. That's 1 hour out of their day that they're obviously not working.
We did it with a bunch of other towns
Yep,
in the
that's,
past.
it's in Hanover, but here's the problem with that.
We did it here too, though, and a bunch of people came here.
Okay, I don't know when they did that. But this the Food Truck Association holds an annual group inspection. And so I've done it the last town. Anybody that has a food truck can go around most towns, and this is how I would do it here. If you want to be inspected there on that day, you need to have all your paperwork in and completed and paid 2 weeks prior to the event. That gives Lori and I time to make sure that you have all your documents, everything's in a row, and then I go the day of that mass inspection, and I have a list of people who have already paid, provided me with all their documents. I go on their truck and I do their inspections all in one place. It's great for me because I bang out a whole bunch of inspections in one day versus, oh, this one can come at 8. Oh, I gotta be back for 2. You schedule the day and you.
It's
and
a
you do it.
win-win all around.
Yeah.
Because those trucks can be seen by as many towns as
Right,
that are
and it's
there.
not, but the issue becomes is not everybody goes to it, not everybody's part of the truck association. So we are still gonna have people that are gonna come here for inspection, which is fine. But I think the big issue for me is the price. I'd like to see it reduced down to $100 to make it more manageable. You figure if you have one truck and they do all 6 of the grant, that's $600 for a season that maybe lasts 5 months. And you really delegate it to the weekends, because it's not like you're doing a ton of business Monday through Friday. You can't park on the street. In most places, you're not allowed to just pull up in a parking lot and sell your wares. So I would like to see it, us be sort of small business friendly by reducing that fee to be $100. I don't know how everybody feels about that.
I'd be curious to see what the other towns are charging. Locally, see what Carver's charging, Plimpton, Duxbury, Marshfield, Plymouth. And, because who knows, maybe they're charging even less than 100,
Yeah. Well,
But
here's
to-
why I wouldn't want to go less than 100.
because it becomes,
Well, how do I justify charging less for a food truck when I charge $75 for a 1-day permit?
Mhm. But that would encourage, so think of it this way, if we charge $75, it would encourage our 1-day permits to just go after having their whole food truck.
Well, food
inspected.
truck can't get a 1-day permit. You must be licensed as a food truck. It is a mobile food vending. You
Okay,
should not be
Right,
getting
yeah.
a 1-day permit.
Right,
Somebody
the
that,
one-day- The 1-day permit is not for food trucks. The 1-day permit is for just that. So a church
it's for like
event,
the
a Lions
church
Club,
having a,
flea market, something
Okay.
along those
Bizarre.
lines where we do the food. It's a
Yeah.
different thing.
yeah.
okay,
So food
This is
trucks always
strictly
have to be
food
licensed.
truck.
okay. The earlier, it sounded like a food truck could do the one,
They're not
Big.
supposed to.
and that's why I was saying, why not make it so we can at least get eyes in there and.
Right. Yeah, that's why I would say $100 is
Okay.
reasonable.
I'd say that's.
Yeah, I would like to vote on that. Or you really feel sincerely that she needs to look at the other towns?
I know that, like, when I was in Milton, we charged $100. I'm pretty sure Middleborough charges $100. I
Okay,
think
well,
that's like
let's
the
do it
going
on
rate.
Wednesday.
This item would require a vote.
Yeah,
We're still talking and we can,
I can't imagine anybody charging less than 100, especially.
Okay.
Oh, I
Duxbury.
know they can
We
charge
can't break-
more.
I get down there
They're
for
in the best
muffins every
position to
3
know.
days a week, it's $3.
This is
in the
also for
best
an
position
annual
to know.
permit.
okay, let's make a motion to change the food truck fee to $100 per year for permit.
I second.
Okay, motion by Heidi, second by Bill. Any further discussion on this?
No, I think we talked it to death before we made the motion.
All in favor?
Aye.
Okay, fine. Now
Is that
the second-
unanimous, Joe?
Yes, it is.
Thank you.
The second item is a report on the recent modification with to a contract with the Old Colony Planning Council. Joyce?
So when I was doing this case that I was talking about and another one, it came to my attention that for the past 11 years, the board has been paying the $550 administrative fee.
Didn't we talk about this last meeting?
Yes, well, now it is rectified.
Okay,
So I just explained to them, I said, well, I do not have money in the budget for that, so either we change it or we're going to need to put the program on hold. And they were able to come up with a new contract. And so now it will be that the person, and we've also changed the procedure, because before it was just going to the Old Colony, and then after all the stuff's been done, it's getting sent to us, and that's sort of very backwards. So now, people will apply through us. I have the packets. I will review the plans. I will say, yes, this is in compliance with what it needs to be. And then they will pay the $550 to the town to cover these fees. Then it goes off to Old Colony. And that goes, and so that's how it's gonna be going forward. So they will be paying their own fees.
would you like to know what Duxbury's getting for food trucks?
Go ahead.
$65 annually,
Oh, wow, that's cheap.
since most are seasonal. Or they can get a 1-day permit and it's $30.
That's insane.
But I've never even seen a food truck in Duxbury, and I'm there 3 days a week.
Yeah.
Trucks at the beach all the time.
Oh, at the
But
beach,
that
yeah.
doesn't cover the cost of an inspection. Like, the time it takes you to do the
Yeah.
inspection, that's insane.
Okay.
That's their business. I think $100 is more than fair. It's reasonable for what's expected is to complete the inspection. People also take it seriously.
Yeah, no, I was just curious to see.
Yeah, I'm
Yeah, yeah.
shocked,
Just
I'm not sure.
really.
Okay, so does anybody have any questions on the betterment loan program? as it's currently structured now. So,
No, it sounds like Joyce wrapped that up.
yeah, so it's good.
All right, next
Okay.
one is the IMA. I have that document downstairs. I'll bring it up when this is over. That's for the grant. It's just, we have to do a new one every year. This one, they took the language of, it used to say that should the state not have any more money, that we agreed to continue the grant and shared services. And all of the towns like, wait a minute, that's not what we signed up for. So
Yeah.
this contract says basically, nope. If the money dries up, the shared services dries up, or a town can opt to stay in it, but it's not a requirement. And
Okay,
it's already passed, it's been passed through the selectmen, so now I need,
Yeah, that it went to town council.
what's that?
It also was looked at by town council, so.
Oh, yeah, that was the first thing I did, is put it through town
so
council.
that's downstairs?
Yep.
So we could just swing by and sign it?
Yep. And then tobacco fines, just a heads up, we did compliance checks and I believe I have about 6 fines. So those letters will go out. I will give 30 days for remittance. Should
What are the
somebody
issues?
not turn it in, then I'll issue a cease and desist and pull the permits for tobacco sale.
Was this from the last time they were caught?
There are a couple of repeat offenders. No, they have to have compliance checks at least once a year.
This is
And
selling to underage?
yeah, and so the buys are controlled. They send an underage person in. There's certain criteria that gets checked off. Was a sale made? Was an ID asked for? You can look at the reports and you get a report. So I have it, to best of my recollection, there's 2 places that are repeat offenders. And a couple of new ones, or they haven't had an event in the past that I could find on our files in the past year, so I'm
You mean
treating
the
it as.
repeat ones?
No, the repeat ones screwed up last year too,
So there's
but
2
the
of those.
other couple that we got, I don't have anything in the system that shows that they've had any previous violations.
No, the repeat ones, what's the fine?
$2,000.
Yeah.
How many times are we gonna let them do this though?
Well, the rules are,
Yeah, there's a rule.
there's state statute, first time is 1,000, within, I want to say it's 18 months, it's 2,000, and 3 times is 5,000. But you, as a board, can just say, no, I'm sorry, you can't sell cigarettes anymore.
That's happened
That's, you
before.
guys can
Has it?
make that decision.
Cause I feel like 3 strikes you're up.
That would
That's
be
me.
my recommendation.
Okay,
I
so
mean,
we only have people who have offended twice
well,
that.
I
you know,
can find records.
That you can find records.
Yeah.
Okay.
So just kind of letting you know about that. And then I just, I did briefly check in with, Joe about cease and desist orders for like when people don't get their permits, you just decide they're not going to pay their permits or bother to apply for a permit or different situations that come up. I need to clarify what the rules were here in Kingston. And Joe said that is up to me, that basically I would obviously do this anyways, but if I were to issue a cease and desist, all of the board would be notified by email prior to it being served, so you'd be aware of it. So hopefully everybody check, not that we're gonna have anytime soon, hopefully, but you know, it would come to you by email so that you would be aware that order has been issued. And that would only be issued in the case of somebody complete non-compliance and not willing to do what they need to do. So that's it for me.
Well, can we go back and revisit this about the people who weren't in compliance?
What
with
about 'em?
us with,
Oh, the
underage?
tobacco? Yeah.
Yeah, I mean, if we're gonna have a ruling, yeah, 3 strikes you're out. Shouldn't something be written somewhere? So
Well, that
they-
would
Well,
be
I
up to the
think, I
board.
think it comes to us when we've got a 3rd strike.
Yeah.
But
It
isn't that-
always,
But to me, that's too late.
well, what I can do is forward everybody tomorrow. I can forward you all the tobacco rules, like what I'm getting for guidance from the state that says what has to happen. And you guys can look at it, and then my suggestion is that we discuss it at the next meeting and come up with parameters, how you all want to handle it. You'll get no argument out of me
It's
if
just- I
if I
think people should
personally.
know if they get a second warning. You know, if you
You're
get a
obviously
third
not
warning,
taking it
that's
serious, like.
Yeah.
Yeah.
What
So-
about alcohol?
Alcohol, we do not enforce, that's the ABC. So it's not us, thank God. That's a whole nother kettle of fish. So tobacco's hard enough. So, maybe that's a discussion that we have the next time. How do you guys, I'll send you all the information. Everybody will have time to look it over. And you guys can, let me know what your thoughts are, and we can draft something up that says this is how the town of Kingston wants to move forward with how we issue tobacco permits and issues when they come up, what do we do about it? And we can also, I believe, issue a stop selling for 30 days order as well. So you can look at that. I have not sent out the fine letters yet. I just got all the information. So I'm going through, I'm highlighting what was in fact done to make sure that it's a legitimate violation. So we have a little bit of time, but we can certainly discuss how you wanna deal with the repeat offenders. Okay,
Joe, didn't you, years ago, I know the gas station lost theirs for quite a while because of the third offense. Didn't we already have all this, Joe?
We had this discussion not long ago when we had a violator come before us and the new state fine schedule had kicked in. And we sent a letter, Bill, to all of our license holders explaining these fines, these potential fines, these liabilities that they could incur if they had a violation, and that the Board of Health was powerless to adjust or modify those fines. That's what we've done up to this point.
and
This
I
is
hand
different.
delivered them.
I'm sorry,
Hey,
yeah,
people.
we did all that. This discussion now is centered around potential additional fines.
Well, I'm talking like
Sanctions.
20 years ago.
Yeah, right. But this is about additional actions that we may take in the event that they don't pay the fine. Although,
I don't think it should go on payment of fine, Joe.
I'm
I'm
sorry?
talking about repeated offenders
Yeah,
selling
that's what
to
I'm talking about.
minors.
Yeah,
I think
Well,
we have
that's
two
what this is
issues
about.
here.
that's what the entire thing is about. They're
Yeah.
fined for
So let's,
selling to a
can we put that on the agenda for our next meeting?
Absolutely.
Sure, you want to, yeah, sure, absolutely, of course we can. Okay. Well,
I will
unless
put that on
anybody
and
has- yeah,
for
we can do
next
that.
time, and I will send everybody all the information.
Does anybody have anything else other than?
yes, I would like to follow up on the orientation manual for new board members. I heard that was distributed at the last.
It was, and I asked everybody to forward
Take a
comments.
look at it. Do you have any comments, any additions, any deletions? Well, can we put that on the agenda for the next meeting?
Oh, I think everybody needs to have a deadline, because I did give them a deadline to email you, so people were told. So how about everybody gets Janet their comments by next Friday?
Okay,
That will give you a
sounds
little
good.
over a week to get your stuff together and give Janet comments.
Okay, I'll incorporate it into it.
And then we should put it on
Send
the,
it to Lori.
whatever you do, we'll put it on the agenda for next time.
It's pretty cut and dry. There's not a lot of anything controversial.
Yeah, I didn't find anything
Well,
controversial.
Then
Yeah,
just
is the-
email her, no comment.
Yeah.
So we have it.
I mean, there's the vision and there's,
You did a great job with it, Janet.
thank you. Well, I looked at several, across the country, kind of get an idea, particularly as far as the vision and goals.
Okay, well, our next meeting is tentatively scheduled for February 5th. But barring necessity for that, we'll probably be moving it to the middle of the month.
Probably.
Joe,
Does
I am
anybody-
out of the country, February 13th to the 27th, and will not be available.
Well, I hope you have a nice time.
I always
Um,
do.
Where you go?
That's a good thing. Okay, does anybody have anything else, or is that it?
That's it.
That's it.
Okay. Then
Motion to
we'll thank you.
adjourn?
Second.
All in favor?
Aye.
Bye.